And what results is this localized contraction within the muscle that causes pain, discomfort, referred pain.
We're here at Hopscotch Fitness with Louise,
Yes.
Louise Spindler. So Louise is a full-time myotherapist and remedial massage therapist at Hopscotch Fitness. She is passionate about helping people out with pain and discomfort caused by the stress and the physical demands people place on their body. Louise has an Advanced Diploma in Myotherapy, a Diploma of Remedial Massage, and a Certificate of Pregnancy Massage.
There you go. That's me.
There we go. We've heard of this trigger point work, right? Of trigger point work. What is a trigger point?
What is a trigger point? Most people would think of a trigger point as a knot in the muscle. In the textbooks, it's probably a hyper-irritable spot in the muscle. It feels like a little nodule within a taut band of muscle, and it's generally caused by overloaded muscles or some kind of damage to the muscle, and what results is this sort of localized contraction within the muscle that causes pain, discomfort, referred pain to sort of areas close by. It tends to, because it is so tight, not have very good blood flow, which means the body's sort of less able to remove any waste product and bring nutrition into the area for it to heal.
So the reduced blood flow, does that add to the pain and the dysfunction of that?
It sure does.
Point?
Yeah, yes. Because it is so tight, that does sort of contribute more to the dysfunction. And then it's just tight and painful and awful.
Tight, painful, and awful.
Yeah.
All right.
It's like a traffic jam in there.
A traffic jam.
Can't get the cars through. Or at least like maybe one lane, but the other three are blocked.
Okay.
That's what I'm going to go with.
All right. So if we've got a traffic jam, then we're not seeing the usual functional level of that muscle. Is that
correct?
Is it in the muscle, or can it happen in?
It's in the muscle.
Yes.
It's in the fascia. Well, they're all kind of interrelated. Okay, let's not talk about fascia. Forget the fascia. It's in the muscle.
And you also talked about a referred point or referred pain. So we can get referred pain from a trigger point. Talk to us a little bit about referred pain.
So we have some common referred pain patterns that we see a lot of. And you can probably speak to this a bit better than me, but there's this shared, I guess, neural supply to the area. And when you have this dysfunction with a trigger point, then your, I guess, brain might interpret this trigger point as potentially pain somewhere else. It could be in your head, and maybe you're going to be like, oh, I've really got this headache. It's really annoying. And you might think, oh, just pop a Panadol or something like that. But it could actually be referred pain from a trigger point in, say, your upper trapezius.
Okay. Whereabouts is my upper trapezius, and what might that refer to, for example?
The upper trapezius is up here, top of the shoulders, I suppose you'd call it. And it refers up into the side or the top of the head.
So
around here.
Okay. So what I'm hearing is we might be experiencing pain maybe in this area.
Yes.
But the problem is down here.
Correct.
I see. How do you go about distinguishing the difference between this being the root cause of the pain versus this one? How did you know that?
How do I know?
Yeah.
Well, I think if it was a headache and you popped a Panadol, it'd probably go away, for starters. Within the treatment, when I'm actually working away, touching things, if I'm working on it and it reproduces that same pain, then that's a pretty good indication it's actually the trigger point causing the problem.
So we can push on the trigger point and that causes the familiar pain?
Yeah, yes. Or it could already be painful, and then when you do touch it or push on it or squeeze it, it'll make it worse.
In terms of alleviating and working through trigger points.
Yes.
So you've obviously got a lot of techniques as a myotherapist that you can go to.
Sure.
Talk to us a little bit about what that might look like.
I've got all the classics, massage type techniques, myofascial release techniques.
What does that kind of mean?
This is more of you put a shearing force on it to get it to try and separate. So your skin and your fascia can move independently of your muscle and it doesn't feel like it's just glued together. Is that a bad description?
No, I like it. I like it. So we'll also just step back a moment. If we talk about fascia,
yes.
What would you say? How would you describe fascia?
Fascia's everywhere. I would describe it as network of connective tissue. It's so much. There's so much going on with fascia, and obviously it helps transmit force. So it's not just your muscles; it's also your fascia.
I like to describe it as a bit of like a glad wrap of the body. It just goes everywhere.
It does.
Right?
It really does go everywhere.
Thin, networky, connective tissue that is absolutely everywhere.
It's everywhere.
So yes, as Louise said, if there's dysfunction in the fascia, then we're going to see that could cause pain and that could cause dysfunction in other areas.
Yes.
As well. Yeah.
Correct. I think so.
So we could use bringing it back. Bring
it back.
We could use those myofascial techniques.
Yes.
And so you mentioned it was a shear force.
Yes.
So you're somewhat separating, so as though the layers have been matted together and you're trying to get them sliding a bit better.
Yes. So I might like put like this flat part of my elbow down, maybe give it a bit of a turn and then slowly just move along and allow the body to just go as it gives.
And how might that could be different from another technique that you would use?
Oh, yes. We've got like massage techniques, myofascial techniques, using pressure with thumbs or fingers or squeezing if you're really getting into it. Or I might...
So with the squeezing and with the pushing down, what's happening there? Yeah, why would I push on the sore thing?
So we're just trying to create, they call it ischemic pressure. I think I've said that right. Where if we put pressure on it, could be 30 seconds, 60 seconds. We're just trying to block the blood flow and then give it some time. And once we take the pressure off, hopefully whoosh, we get a big whoosh of blood flow going through there to hopefully loosen it off.
So we're seeing an increase in blood flow after this inhibition.
Yes.
Yeah.
Okay.
We got to talk dry needling.
I mean,
we may as well throw in cupping as well.
Oh yeah, cupping. I mean, cupping's nice.
Do you have a...
Do we have some cups here? They're a bit
here we go.
probably greasy.
It's all right. So we've got one of these cups. What happens with this?
This just creates, I guess, a negative pressure against the skin and the fascia. And it's just another way that we can sort of manipulate the soft tissue to like pull it apart and get some blood flow into the area.
So it'd be like separating, drawing apart these different...
The different layers of tissue.
Layers?
Yeah. And I just find that actually cupping desensitizes things. If something's feeling just very tender and sensitive, I might park some cups there for a little while, treat something else, and then come back to it.
We have to talk about dry needles. Do we have any in reach?
They're very, very tiny.
All right. So how are they? They're as tiny as a piece of hair, right?
Yeah. Well, these ones are 0.2 of a millimeter. I don't know which.
0.2 of a millimeter.
Far smaller than a needle that you will get at the doctor.
Dry needling.
Yes.
It's something that you use as a myotherapist.
Yes. Honestly, it can be less brutal than using your thumbs or your hands. You get right into the trigger point, and quite often you'll get this twitch response. And
so the muscles will twitch when you get it?
Yeah, and look, sometimes that's a little uncomfortable for the person. Sometimes it's fine. It doesn't always twitch. Quite often when you get that twitch response, you can see or feel that the tension goes out of the muscle.
Great.
And it softens up.
Great, really good. I was doing a bit of reading about dry needling and why does it work. Long story short, we're not sure how it works, but it works.
We just know it works, so we do it.
So we've mentioned kind of upper trap, referring to the side of the head. What might be a couple of other common trigger points?
I would say SEM, sternocleidomastoid, these guys here in the front of the neck.
Where might that refer to?
Usually maybe the forehead or behind the eyes.
Okay.
Actually, they're the main ones that I think of: upper traps and sternocleidomastoid, and like suboccipitals.
Yep.
They all just refer up here.
Refer up towards the head.
Look at my poster.
As per the poster. I got to add one in just because of the pterygoids inside the mouth. So we've got deep muscles of chewing, of mastication, and they can refer pain in and around here, so through the cheekbones and in front of the ear as well.
There you go.
So working through, so sometimes people can come in with pain through this area when really it's pterygoids deep inside the mouth that's causing this, what could be thought of as sinus pain or what could be thought of as ear pain. I just had to add that in.
I mean, that's fair. I've had those worked on and they bring a tear to your eye, I think.
They do.
But also for me personally, when I had them worked on, I'm like, oh, my neck feels so much better now that I've had those guys worked on.
Interesting.
Funny that.
So once you've treated a trigger point, am I fixed or will it come back? What does it look like?
Well,
so you just mentioned my neck pain feels so much better after working on those jaw muscles. So
now you're free and you're cured. No.
Oh.
It really depends.
Yeah.
What's the cause? Is it like a one-off, you slipped over and like whacked your head on something? Or is it like I sit at a desk for 100 hours a week or 60 hours a week and I'm always in that same position and maybe my posture's not as good as it could be? So it depends what the cause is. If you're not moving much, I think that's going to be a problem. Or if you're doing something really repetitive, you could also end up with problems. So we just want a nice amount of movement, you know.
I think you also said repetitive, so we want a variety then?
We want some variety. I often ask people, do you have a sit-stand desk? Might be worth changing positions every hour or going for a tea break or just doing something different, just moving around. It could be a case that you need some kind of regular maintenance to keep it all in check.
Okay.
Whether that's with you, whether that's a massage with me, or whether you self-treat with like heat packs or massage balls or foam rollers, stuff like this.
So if we can't remove those maintaining factors, that, you know, we can't stop being in that position for work, let's say, then we need to do something else to help us. Having a look at either seeking out massage or osteo, for example, and looking at other things that might be a heat pack, might be a cold pack, might be tape, might be...
Could be a million things. We're both big fans of exercising, stretching, mobilizing, keeping moving.
Yeah.
Especially if you're constantly sitting, then, you know, maybe it'd be nice to stretch your hips and back into positions you're not normally in. I think it's a good idea.
I think so too. And then finding something you like as well. Because
that's a big one. Finding something you like is a really good idea, or else the probability of you continuing, I think, is going to be pretty low. Yeah.
And some people absolutely love massage.
Yeah. I mean, I'm
a lot of people
into
do.
it. Yeah. Yeah, I don't mind getting a massage.
Guys.
I mean, it can be painful, but then I'm always like, yeah, feel pretty good.